Coronaviruses are a group of viruses that can cause a range of symptoms including a runny nose, cough, sore throat and fever. Some are mild, such as the common cold, while others are more likely to lead to pneumonia. They're usually spread through direct contact with an infected person. The coronavirus gets its name from the crown-like spikes on its surface, according to the CDC. Corona is Latin for crown. Including the newly identified form of the virus, there are a total of 7 coronaviruses that can infect humans, the CDC says. The new coronavirus's incubation period, meaning the time it takes from a person being infected with the virus to when they start showing symptoms, is still unknown. However, public health experts are working under the assumption that the incubation period is about 14 days. The World Health Organization says that the incubation period, on average, is about 5 days. How does the coronavirus spread? When an infected person coughs or sneezes, they release droplets of saliva or mucus. These droplets can fall on people in the vicinity and can be either directly inhaled or picked up on the hands, then transferred when someone touches their face, causing infection. For flu, some hospital guidelines define exposure as being within 6 feet of an infected person who sneezes or coughs for 10 minutes or longer. Viruses can also be spread through droplets landing on surfaces, such as seats on buses or trains or desks in school. However, whether this is a main transmission route depends on how long viruses survive on surfaces. This can vary. There is anecdotal evidence that the virus can be spread by people before they have symptoms. Some other illnesses, such as flu, can be passed from one person to another before symptoms occur, but the extent to which this is happening with the new coronavirus is not well understood yet. How to protect yourself and others. Number 1. Wash your hands. Wet your hands with clean, running water and apply soap. Lather your hands, including the backs, between your fingers and under your nails, and scrub for at least 20 seconds. Number 2. Cover your mouth and nose with a tissue when you cough or sneeze, then throw the tissue in the bin and wash your hands. If you do not have a tissue to hand, cough or sneeze into your elbow rather than your hands. Number 3. Face masks offer some protection as they block liquid droplets. However, they do not block smaller aerosol particles that can pass through the material of the mask. The masks also leave the eyes exposed, and there is evidence that some viruses can infect a person. Number 4. Seek early medical help if you have a fever, cough and difficulty breathing, and share your travel history with healthcare providers. If visiting live markets in affected areas, avoid direct, unprotected contact with live animals and surfaces that have been in contact with animals. How many people have been affected? As of 6 March, the global death toll was 3,404. While more than 100,000 people have been infected in more than 80 countries, according to the Johns Hopkins University Center for Systems Science and Engineering. The death toll has passed 3,000 in China, where there have been over 80,000 cases. South Korea, the nation worst hit by the outbreak outside China, has had 6,593 cases. More than 55,000 people in China have recovered from COVID-19. Thanks for watching this video. If you like this video, please subscribe my YouTube channel Azoic Ashik. Take care your health and your family.